First part of the examination is inspection and observation. Ideally, the patient will be long sitting on the couch. We need the feet, the lower legs towards the knees exposed, so this is ideal. We want to be looking at the legs from the head of the bed. So I'm going to move over to this position. So you can see, the first thing to think about is hair on the legs. So people with peripheral artery disease often have very smooth, hairless legs. So we can look at the lower legs, we can look at the feet in particular. The issue with hair is it's not particularly sensitive. Many people have a lack of hair on the legs. Mark particularly has never had hairy legs, so it's not going to be particularly diagnostic, but it might be a helpful clue that we can document in our notes. The next thing to think about is the skin itself. People with peripheral artery disease often have very dry, brittle skin. They often have shiny skin as well, so you might look around the feet to see if there's any shininess. And the other thing it says that the skin is often discoloured, so blue and purple hues to the leg or mottling to the legs can be a useful clue. But again, with the skin and with the hair, they're not particularly diagnostic, so we're not going to necessarily rule out peripheral artery disease based on a lack of these factors. As we can see on Mark's leg here, the skin is dry, it's quite thin, and we can see the vessels underneath, and that kind of opaqueness may be a clue to there being a problem with the arterial blood supply. So we're moving down to the foot now. I like to elevate the foot so you can see underneath the calf and around the Achilles region. The first thing to do is to look at the nails themselves. So people with peripheral artery disease often have slow growing nails, so they may be rigid, they may be short, they may not grow particularly well. The other thing to look at is potential tissue loss, so ulceration and gangrene. So looking between the toes themselves, looking for any ulceration, looking at the heads of the metatarsals, looking at the heel, and in this position we can nicely turn the leg on and we can look under the Achilles region for any ulceration as well.